Inside Utah Politics.
Thanks for joining us. I'm Glenn Mills. It is time to go inside Utah politics. We do begin this morning with Taryn Hyatt. She is with the American Foundation for Suicide Prevention, here to discuss mental health and the legislative session. Taryn, always glad to have you on the show. Thanks so much for being here.
Thanks for having me.
First off, give us a state of suicide here in Utah. It's been a big problem for quite a long time.
Yeah, it really has. You know, suicide continues to be a leading cause of death amongst young people. 2021's data was just released by the CDC, and you know it doesn't look good nationwide. We saw an increase again. Utah, we still continue to see a stabilization, but our 2022 numbers that are kind of preliminary aren't looking so good.
Yeah.
So we just need to double down our efforts and make sure we're
It was good to see that for
it.
a few years, but still we tend to be on the higher side across the country.
Yep, we do. We continue to be in the top 10, and that's a place we just don't want to be ranked.
Exactly. Okay, let's talk about how we can make some improvement when it comes to that. One thing you and your organization does is you have this State Day on the Hill. That was on Thursday. It's where advocates come together on Utah's Capitol Hill. They meet with lawmakers and really tell personal stories. Talk about the impact of that.
Yeah, we invite our advocates who've been affected by suicide to come and share that experience, right? We want to educate our legislators on how suicide has impacted our lives, what could have been helpful for their loved ones, what could have been helpful for them, so that we can continue to get ahead of it and again be more upstream. We want to quit just reacting when suicide happens and instead create programming and things in our community that prevent people from getting to that place of crisis.
Whether directly or indirectly, this is something that really impacts all of us. How do you see lawmakers responding to this?
You know, we've had a lot of years with folks who've been really dedicated to this. As you well know, Representative Ellison, Senator Thatcher have all been incredible. And we've seen others start to step up. But again, we need to continue the momentum. Sometimes I feel like they hear it so often from us that they maybe start to tune out a little bit. And I want them to not take their foot off the gas. You know, we need to continue to create programs and strategies to keep people safe.
This is something that has impacted you personally. I know that drives you in this work, but talk about how that personal impact motivates and helps you want to make a difference in our state, you and so many others.
Yeah, you know, we lost our dad, as you know, to suicide 21 years ago, and that's what got me in this movement. You know, I also am somebody who struggled with my own experience and attempted suicide multiple times. I had kids that struggled with this during their high school years, and thankfully we made it through. And now I'm actually working down at the state hospital doing my internship. So again, I'm getting to see firsthand. And when you see that and experience that devastation, it motivates you to want to change a system that maybe failed you or your loved one and didn't have the tools in place to get them help.
One tool that has been put into place that is a really big one, we were just showing some video of it, is the 988 hotline. So I want to go ahead and hit on that since we just saw that video. That is something that local representatives at the national level helped push through. Talk about how that has been implemented and what it is and the difference it's made. Yeah,
so 988, the 3-digit crisis line. You no longer have to remember that long 800 number. And again, thanks to Dan Thatcher and Ellison for bringing that forward, and then Representative Chris Stewart and Orrin Hatch taking it through the finish line. So it was implemented back in July. We've seen an increase in call volume, which is good. Again, we've been preparing for this. We have folks who can answer those calls, but folks can access crisis services 24 hours a day, 7 days a week, by just dialing 988 or texting 988. If you press 1, you get veteran services. If you press 2, it goes to Spanish. 3 takes you to the Trevor Project LGBTQ Lifeline.
I know this, you know Laura Warburton.
Yes.
She's an advocate. Yeah. She lost her daughter. Yeah. And one thing that really troubled her is that her daughter reached out. She made that call, but there wasn't someone on the other end of the line. You call this number, someone's going to be there.
Yes, yep, we've made sure that we have call capacity. Again, it's routed based on your area code, so it will route you to your local crisis center. If that crisis center is full, there's a rollover capacity that it takes you to the next local available one.
And that's really important because sometimes this can be an impulsive decision.
Absolutely.
So we need connection.
We need connection right away. Yeah. We know that people who are contemplating suicide, from the time that they think those thoughts till actually acting, is a really brief time frame. So getting help immediately is important.
All right, glad to see that up and running. Let's get into some of the bills you're following this legislative session. We'll start with House Bill 248. That would create a long-term statewide assertive community treatment, or ACT, team plan. What is that all about?
Yeah, so ACT teams are a really important part of the mental health crisis continuum. So it's called Assertive Community Outreach Team. These are teams that we already have them actually in Salt Lake City. This would help to put one down in Provo. That again is a multidisciplinary team that can help support people who have serious and persistent mental illness. So psychiatrists, doctors, physicians, people that can come to you. So again, they can help to stabilize people within their homes so that they don't have to have that really intense inpatient care. We know that for some, that is not actually as helpful as it could be, and when they transition out, they need to have additional support. So ACT teams would help us to do that, and we're appreciative of Representative Judkins bringing this forward.
House Bill 66, kind of a similar concept with mobile crisis outreach teams. Talk about how those would work.
Yeah, so again, Representative Ellison has continued to push for this. This increases our capacity to have more mobile teams. So again, when you call 988 versus law enforcement coming, a mobile crisis team is a peer support, a licensed mental health professional in plain clothes, no lights and sirens, coming to your house to again assess situations, de-escalate if needed, and then get you to appropriate care and support.
I've heard him say, important that you say they are not marked, so that the security of what's happening there is saved. But he has described that before as like a mobile ambulance or an ambulance team to get out into these crises.
Yeah, and again, they're going to respond quickly, but without the lights and sirens that your neighbors have to know and wonder what's going on. And again, saving us a costly ambulance bill if we do have to be transported. They can transport you to our receiving centers and again, get you help immediately that isn't in an emergency department.
House Bill 228 would prohibit conversion therapy in the state of Utah. We know Governor Herbert made an administrative rule. This codifies it. It's already passed the legislature. Talk about the impact you expect that to have.
We know this is going to be huge because, again, we have said to our LGBTQ community, you are perfect the way you are. We're not going to try to change you. We know that that's a harmful practice, and now it's in law. And I just want to give kudos to every single person who was involved in that. We really saw our state come together, regardless of party, regardless of beliefs, and work hard to come to a bill that would benefit people. So I appreciate that.
Yeah, because I know LGBTQ advocates were really concerned that this could potentially do the opposite, but that compromise came together. There are also some bills addressing the trans youth community here in the state of Utah. Those have already passed, and they've been signed into law. So given that that is the case, what do we need to be aware of and watching for those that we may know who are feeling down about this?
So we need to rally around again our trans youth. Just like we talk with our LGBTQ community, these people exist. They've always existed. So let's show up and support them. So yes, there's a ban now on their gender affirming care. So if we know they're now going to have to possibly wait till 18, how can we show up and support their mental health, affirm their existence and livelihood until that time? We don't know what's going to happen with that bill. There'll probably be some litigation, but again, we can all show up and just show love and kindness to one another. And I want those trans youth just to know we see you, we got you, and you deserve to be here in our state.
There's been such a focus on mental health in the state capital, even the nation's capital of late, and you and your team of advocates really do important work. If someone at home is saying, this is something I would like to get involved in, how can they do that?
Yeah, visit our website, afsp.org/advocacy. Sign up. We help keep you informed of what's happening nationally, locally. We'll train you to meet with your legislators, and what does that look like? Our legislators need to hear from us, and they want to hear from us. So by sharing your story, letting them know how things have affected you, you get to have a voice in this process, and that's important.
One more week to go. You will be a busy person.
Yes, you
right.
too.
Thanks so much for being here with us. We really appreciate it.
Yeah, thanks, Glenn.
Still to come, a member of Congress suggests